Hey guys, it's Dr. Emer. We're now doing the Rhinophyma portion of the CO2. Take a look how his skin is very thick here on the nose. This happens to both men and women, more in men with lighter skin tones. So we're going to work to actually shrink these down. The downtime is much more, unfortunately, because we have to really shave these guys down. But right now we're doing our first pass, a really strong treatment setting. But because there's so many oil glands here, it actually heals relatively well, typically without any issues. There's numbing on here. Can you make sure it's on full blast? And we're going over the area pretty aggressively. We're doing good. Especially this circular area in the middle. We're doing a second pass right now.
No, this is not Fraxel.
This is a CO2 laser. This is ablative resurfacing. This is basically to shave down and shrink the skin.
What causes the thickened skin, though?
Nobody knows, you know, sometimes it's just genetic, sometimes it's just what we call bad luck. Just happens. So now what I'm going to do is go to Resurfacing. I'm going to take a little bit of a wet gauze. We're going to shave down the skin a little bit. Too wet. And you see how far we were able to get the skin. This is kind of an older school technique, but works really well for Rhinophyma. And specifically for Rhinophyma, you really want to shave the skin. You're really basically blending the skin. Okay? So we're taking off that upper surface.
Does this work on darker skin types?
This would not be safe for a darker skin type. It would cause severe hyperpigmentation, most likely, or even hypo, to be honest. Okay, so we're getting that all, shave it down. Are you okay with the pain? Nothing? Okay, good. Nothing short. Trying to limit the swelling by only doing a small amount of nerve block. Nothing really too crazy. You guys can see, even with this first pass, now the dry gauze. Grab that for me, PJ. Even with the first pass, there's not a lot of bleeding, which means the skin is really thick. And we can go deeper with the laser. So we can do another pass. You can see it's already smoother, but I want to focus on some of these sort of knotted areas. You can see here and there. Okay. So we're going to go some of these problem areas and kind of shave those down. And then blend it. And this is an art doing Rhinophyma. Not a lot of people do it because of the downtime, but also just the need to have more of a planned approach to treatment. And it takes many passes. And you can see here, turn your head to the right for me. There we go. You can see here, there's some thickening that we want to bring down.
The specific depth that you're looking to.
Usually we go to about pinpoint bleeding. Usually, but it's more of a look than it is. It's more of a look than it is the actual depth. I don't know the answer to the depth until I see where people have really thickened glands, like right here he does in the middle bulbous part of his nose. We're gonna probably need more passes. And we'll do one more shave. Like I said, I don't want to go too aggressive like we used to do in the past, as I want him to have an okay healing time. But I also do want him to see a nice result. Turn a little bit here. There we go. And each pass of this, you guys, shaves down another layer. Okay.
Is this safe for sensitive skin?
You know, this is not a sensitive skin treatment, you guys. This is a treatment for severe skin condition. So now we're going to take this back.
Yes, this is a CO2 laser.
It's a CO2 for Rhinophyma. So now we're going to shave that down a little bit. And like I said, the old school way would be to keep going. But what we probably will do is one more and then let it heal, and then we keep doing this over the course of a year. But you can see already, much smaller, much smoother, you guys. You see? Already. You gotta be, I know everyone wants everything immediate these days, but I'll tell you, the risk is much higher if we keep going. Like right now, you're starting to get a little pinpoint bleeding, which is good. If we press, right now we don't see too much of that. So we'll do one more of our bigger pass, and then we'll be complete. Okay, so again, I'm going to focus on, take a dry gauze. Is that the dry gauze? Okay, turn to the left again. So now I'm going to go and I'll kind of shave down the areas I really want brought down a little more. Especially right through here, through the bulbous part of the tip. Some people will do this with a needle, some people will do this with a blade or an electric needle. I'm just using the laser. I think it's a nicer, cleaner way. There's less bleeding.
Is this a one-time treatment?
No, like I was saying, in the past, we did do that. But what we found was the downtime is significant. So if somebody's willing to do his skincare improvements over time, we'll do one bigger one like this, and then we'll slowly wean into a little lighter maintenance treatments. Okay. Now his nose looks fine right now, but it's gonna look crazy in the next couple days. But we'll get follow-ups with him so you guys can all learn. I think it's really critical for people to actually learn about this, because nobody knows there's actually treatments for it. Turn to the right. Perfect.
This is for Rhinophyma.
Yes, this is for Rhinophyma. And that's when you have the enlargement in the area of the nose. Almost there.
Will that skin regenerate over time?
Oh yeah, all this skin is gonna rebuild itself over the next few weeks and form baby skin.
And he'll have to come back about every 18 months?
Well, what we'll probably do is in about 2 to 3 months do a second treatment. Alright, last one. Take that. We'll see how much you might be happy with it after this. And only need, you might be happy with how it looks after this, and only need 2. There we go. Starting to get a little bit of a yellow look, which we want. And sorry for all this aggressiveness here. You may be happy with how smoother it gets already just from this. But most people are a little more aggressive even, where they literally shave this down completely with a blade right through here and here, all this thickening. I just find that long term, it can turn the nose a different color, and it also is much more progressive in terms of healing. Can you give me a bipolar plug if you have one?
No, this is not the Halo BBL.
This is CO2 laser. We're going to do one last pass, but I'm going to, you guys can see some fine pinpoint bleeding, which is what I want. See? So right at that area of the dermis. We're going to use a little bit of a electric needle to shave down small areas of enlargement, like right here.
Who's a good candidate for this procedure?
Anyone with a thickened nose and light skin tone. Okay, turn to the right a little bit. We're using a little cautery. Now it's all pretty smooth, actually. Okay, we do. Okay, last one.
Yes, he's numb.
Okay, last one, we're just going to be more aggressive on the tip of the nose. But we want this char to maintain. For this treatment, you need to be more aggressive, you guys, to get a result. It's super important. So what we're doing is, yes, it's more aggressive, but that's what he needs. He's almost done. It's the last pass. Now we're going to blend the surface slightly.
What is the color telling you? It starts kind of yellow like that.
Well, when we start to get this yellowish color, guys, we're right at those sebaceous glands. And that's really important because that's the healing center. So we are at the right depth here. Otherwise, you go much deeper than this, and there's risk to him of permanent scarring. So we don't want to do that, obviously.
The patient is numb now, but what about afterward? Will he be in a lot of pain?
Not really. This actually isn't that painful. We're going to do healing protocols for him, and we're going to start adding some PRP. You guys can see here, I'm going to start to put a little bit of PRP onto the skin. This is blood plasma. That's going to help him heal much more quickly. He's going to put this also on his nose tonight and tomorrow a little bit, and then we're going to start all of our healing protocols for him. But that's a pretty deep treatment, and we'll show you guys what it looks like over the next few days. And he can tell us in a little bit what it felt like today. That's it. All right, guys, that's CO2, resurfacing, improvement in sun damage, and Rhinophyma.